Hi, I'm Jordyn Rasmussen. I'm a physical therapist here at McKenzie Health System, and I just wanted to talk about a new service that we are now providing here at McKenzie for patients with lymphedema in the arms, the legs, even the chest and the trunk. The treatment is called complete decongestive therapy, and basically there's 4 components to this therapy, with the main goal being to get the limb or the area that has the swelling, the lymphedema, back to its original size. So if you are not familiar with lymphedema, how it's caused, what it is, basically all it is a protein-rich swelling in, it can be your arms, it can be your legs, and a lot of the times it's caused from a traumatic injury. So a lot of times breast cancer, women will have lymph nodes removed, and that can cause swelling in the arm because you don't have your full lymphatic system to take care of that fluid. Some of it has been removed. Sometimes you can be born with it and you can have it in your legs, or even other cancer-related treatments in this area of your body can cause the lymphedema in your legs as well. So it can be caused from many things, and we can treat all causes of lymphedema. To give you an idea of what to expect if you were to come here for this treatment, just as an example, so if you have your right arm that has the lymphedema and it's twice as large as your other arm, you could expect maybe 4 to 6 weeks of treatment here in therapy. So you would be coming 2 to 3 times a week. And this varies depending on the individual and each individual scenario. But for this example, 2 to 3 times a week for 4 to 6 weeks. Initially, we would be wrapping your arm with the short stretch bandage like this each time that you're here. And then we would be doing the drainage techniques, the exercises as you're here to get the limb down to the other size comparable to the other arm. And then from there, we would work on transitioning you from called the intensive phase to the maintenance phase. So that's when we would help order you a compression sleeve, like this one for your arm. So it just goes on your arm. And then you would maintain by wearing this at home on your own throughout the day. And what we would do is kind of help formulate a plan for you on how often you should wear this. And everyone's different, so maybe some people need it for a couple hours, other people a little bit more, but we would formulate that plan for you while you're here so you can maintain in the future the lymphedema and keep it down. So I'm just going to talk about those 4 components wrapped up into the therapy. So the first one is manual lymphatic drainage. And so what we do with this component is do different strokes on the body or the area that's affected to help push some of the fluid to the healthier side of the body to help get rid of it. The second component is compression. So initially using a compression bandage like this one to wrap the limb up, and then transitioning to a compression garment. So this one happens to be for your arm to maintain the swelling to help keep it from coming back. The third component is exercise, so doing exercises with your arms, your legs, even deep breathing exercises to help the muscles contract and relax. And as the muscles are doing that, that's also helping push the fluid to the healthier parts of the body where we can then get rid of the swelling. And the last component is skincare, so just teaching you how to maintain good skin, teaching you what's good and what's bad, what to look for, just a lot of education with that component of the treatment. And so when you would come here, you would come 2 to 3 times a week, depending on the severity and individual basis, but we would work on those 4 things each time you came here until the limb or until the area that was swollen is back down to its original size. If you have any questions, you can call us here at 810-648-0210, and we'd be happy to help with anything that you have a question about. Also, in addition to this service that we are providing, we continue to provide a variety of other services for a variety of other conditions, including acute and chronic orthopedic conditions, neurological conditions. We have a variety of interventions we can use, manual therapy, we have a pool so we can do aquatic therapy. So once again, if you have a question, you can call us at 810-648-0210.